Good afternoon and welcome to the Department of Family and Support Services Community Reentry Support Center RFP webinar. Just a few housekeeping rules. Due to the volume of participants, everyone has been placed on mute. Please submit questions via the questions box and we'll respond to questions at the midpoint and end of the presentation. For technical issues, please make use of the question box to notify us. Please be advised that the webinar is being recorded and anything stated at this webinar is not intended to change the solicitation document. Any changes will be in writing in the form of an addendum issued by the Department of Family and Support Services. The purpose of this webinar is to provide information for the solicitation. A copy of the recording will be posted to the DFS YouTube channel under the Alerts and/or Funding Opportunities tabs on the chicago.gov website. Please give it up to 5 business days to upload. DFSS retains the right to share registrants to this webinar along with their contact and organizational information at our discretion. As for the agenda, we're going to go through the welcome, and at this time, I'm going to give the division the floor to introduce themselves.
Thanks, Jillian. Good afternoon, everyone. My name is Mark Sanders II. I'm the Deputy Commissioner of Workforce Services with DFSS. I am joined by my colleague, Cindy.
Hi, everyone. My name is Cindy Rivera. I am a project manager here in the Workforce Division for DFSS.
Thank you. And at this time, we're going to go through the purpose of the agenda, the background of the RFP, overview and program and service delivery, eligibility, evaluation and selection process, the selection criteria, the timeline, technical assistance for applicant and e-procurement, and then one last round for questions. And at this point, I'm going to hand it over to the division.
All right, thank you. So just to start off with our mission and our priorities at DFSS, our mission is working with community partners. We connect Chicago residents and families to resources that build stability, support their well-being, and empower them to thrive. As a department, our priorities are to deliver and support high-quality, innovative, and comprehensive services that empower our clients to thrive. Our aim is to collaborate with community partners, sister agencies, and public officials on programs and policies that improve Chicagoans' lives and advance systemic change. Another priority is to inform the public of resources available to them through DFSS and its community partners. And finally, our priority is to steward DFSS's resources responsibly and effectively. So for our division, the Workforce Services Division, we are committed to mobilizing innovative workforce solutions that are tailored to the distinct challenges faced by vulnerable Chicago residents. Our focus is on human-centered service methodology, and the division is advancing efforts to deliver high-quality workforce services at the community level in partnership with organizations that have both healthy and supportive workspaces and training environments. By offering a suite of workforce services, including career navigation, industry-specific job training, and transitional jobs, also known as work-based learning opportunities, the Workforce Services Division addresses the workforce needs of adults residing in high-promise community areas. So for this RFP, I want to focus on the purpose. Our division, as I mentioned, prioritizes human-centered services for adults in high-need community areas. And so for our community reentry support centers, we want to locate them within 4 high-need geographic zones. We want to ensure that these locations are centralized within the zone, meaning they are easily accessible by public transportation or other means. We want them to be have access to up-to-date information, meaning they have good standing in the community that they serve, and they have access to a wide variety of resources that returning residents may need. We also want to make sure that they are equipped to provide tailored, customized navigation support for returning residents. For our traditional workforce service models, we focus on career navigation. For our community reentry support centers, we want to make sure that we are providing reentry navigation specifically for individuals that have probation or parole mandates, or who may be struggling to reintegrate into the community after incarceration. And so we've identified 4 high reentry need areas. Zone 1 is we're calling the North Central Northwest Zone. Zone 2, we have the West, and it includes a portion of what we would traditionally call the North Side of Chicago. We have the Near South Zone, and we have the Far South Zone. And so the community care areas and the zip codes represented in each of these zones are explained in detail in the RFP. But as you reply to the RFP, you want to make sure you're identifying which zone you plan to provide in-person services. Next slide. Our goals for this RFP and for our community reentry support centers is to annually field a minimum of 2,500 calls to the call center and provide reentry services, reentry navigation services to a minimum of 420 returning residents. We want to ensure that at least 60% of those 420 residents have a probation or a parole mandate. And also to drill down into the minimum requirements of the calls, we're defining these as engagements as well as calls. So the expectation is that the Community Reentry Support Center will do outreach in the community to returning residents. They will be engaged with the Illinois Department of Corrections. They'll be engaged with Cook County Corrections, and they will make an effort to engage with at least 2,500 participants in the community, and also making sure that they have access to the agency through phone calls. How do we plan to do this, or how would we like the service provider to do that? By establishing trauma-informed community-based hubs in the neighborhoods with high concentrations of returning residents and justice-involved Chicagoans aged 18 and older. These centers will employ experienced, caring staff, build strong partnerships with corrections agencies and local organizations, and offer individualized services focused on workforce readiness, housing, access to housing supports, behavioral health, and legal support. The ask is not that you are providing all of these resources, but to make sure and to demonstrate in your responses that you have access to these resources and others that are high on the needs of returning residents. And you ought to be able to demonstrate the ability to connect individuals to a wide variety of resources that returning residents need and other system impacted individuals. This is an overview of our current state and our priorities for improvement. So the city of Chicago has about 11,000 individuals returning from incarceration or carceral settings annually. 6,694 returned in 2024 from the Illinois Department of Corrections. We know that because individuals who are on parole, they have to have a address assigned to where they are returning. And so we know that at least 6,694 individuals returned to Chicago from IDOC. We also know that returning residents have high barriers to stability. Employment is a significant need for returning residents coming back after incarceration, among other things. And right now, 60%, over 60% of them are often unemployed after 1 year. Many face housing challenges, mental health needs, and substance use challenges. We also know that there are community hotspots where returning residents are likely to reside, and we've identified at least 15 zip codes with the highest levels of returning residents, and they also coincidentally have a high historical precedent for disinvestment in those communities. So what we have is returning is individuals that were incarcerated. They were already in disinvested communities. They go to prison or jail. They serve their sentence and they return to communities that still need a lot of resources. And so we want to make sure that our community reentry support centers are in areas that are easily accessible to those individuals with the highest needs. In 2024, our reentry centers received 11,385 calls. They served with reentry navigation 2,840 individuals, and 46% of the calls that they received were for employment. And so that's why we want to prioritize access to employment resources, access to employment training, and things of that nature in our RFP, and we want to see that reflected in your responses. We also know that those who are returning from incarceration are at the highest risk of incarceration. Nearly 40% of returning residents return to incarceration within 3 years, and this is because they did not have access to targeted support and trauma-informed services. And so our priorities is to address a lot of these challenges that we see in our current state. We want to close the gap on services by creating spaces where individuals can access trauma-informed services, where they can, we want to provide safe and supportive environments for individuals. And so that's where the trauma-informed services are delivered. The spaces and the individuals that are working with those individuals are open to an understanding of the needs that returning residents have, open and understanding of the needs that system-impacted individuals have, and they're able to understand the need and connect them to the appropriate services. We also want to make sure that the services at our community reentry support centers are standardized. We want them to be consistent across the board. There's a sense in the general community that some services are better in different locations or in different parts of the city. So we want to make sure that in any individual going to each of these 4 community reentry centers, regardless of where they go, they'll get the same quality of care. Might not be done in the exact same way, but we want to make sure that it's high quality across the board, that it's consistent, it's outcome driven, and it's trauma informed. We also want to support individuals in their advancement towards economic mobility. We want to provide and refer individuals to job training, employment, and then actual entrepreneurship pathways. We know that every individual is different, and so we want to be able to tailor the support to the individual's need. We also want to build a coordinated reentry ecosystem, and so we will be asking that our service providers stay in partnership with the Department of Family and Support Services, our division, the Mayor's Office of Reentry, and with the other community reentry support centers to make sure that we are co-developing a robust, person-centered service delivery model. We also want to model healthy relationships and resilience among the population that we want to serve. We want to encourage communication and recovery skills to support their long-term reintegration. And so just again, reiterating that they come in with many of them with several high needs. We want to make sure that the service providers and the individuals that they employ are understanding of those needs and have a good system and a good network of care that they can refer those individuals to as they go through the process of reentering their community. So here's a brief overview. Again, we want to make sure you're reading the RFP closely for more details, but we want to annually field a minimum of 2,500 calls to the call center, and we want to engage with the returning residents in a variety of ways, but specifically with the call center. We also want to provide reentry navigation services at each site to a minimum of 420 residents. And we want to prioritize services to individuals that have a probation or parole mandate. And so what that means is if an individual comes home from incarceration and their parole requirement is that they get some type of drug, substance abuse treatment, or they get connected to an employment training program, or if they have another need that needs to be addressed, that is mandated by by the court. We want to make sure that we are prioritizing services to them. However, reentry navigation support should be available as widely as possible to individuals seeking services at these centers. The CRSCs will operate as a trauma-informed, community-based hub, providing tailored support and reentry navigation services to help returning residents and justice-involved Chicagoans overcome barriers to reintegration into their communities and to achieve stability. We know it's a long process for many individuals. It takes several years to fully stabilize themselves, but we also know that without the support that our community reentry service centers provide, they would not be able to do that. And so we want our CRSCs to be a hub to provide a wide variety of support, a wide variety of resources, and we want them to be a connector to other organizations and institutions that have the ability to provide support where needed. Our target population are Chicago residents 18 and older who are returning residents or justice involved. A few of the key performance metrics I want to highlight here: 60% of all participants who receive reentry navigation should complete or are on track to complete their community corrections requirement or avoid recidivism for 1 year. And so, like I mentioned above, whatever it is, some people come home with court mandates. And so whatever those mandates are, our CRSCs, their job is to help connect them to the appropriate resource and keep them on track, support them as they achieve those goals. We would like 40% of all those participants who receive reentry navigation services if this is a part of their goal. Some individuals may not have this as a goal, but if they have this as a goal, we would like to see them connected to an education or an employment training program. As I mentioned before, 46% of the people that call reaching out to our community reentry support centers are asking for employment resources. And so we want to help facilitate those connections, and we will talk through the ways you can document how you do that. We also want 80% of all participants who receive reentry navigations to be successfully referred and connected to their requested need. And so, again, if they have a specific goal in mind, whether it's to get connected to education or a job training program, whether it's to get support with enrolling in public benefits, if they want to go through the process of getting their record expunged or sealed or whatever it is that they're eligible for, we want to ensure that at least 80% of the individuals that are getting those reentry navigation services are successfully connected to those their requested need. And finally, 80% of all participants who receive reentry navigation support, they self-report advancement towards at least one of their goals. And so we're looking for progress in these reentry navigation services. And these are the ways that we want to track these benchmarks is how we'll track whether or not we are successful in this endeavor. Again, our priorities: respondents should anticipate fielding a minimum of 2,500 calls annually to the call center. And so in your RFP, you want to confirm you have the capacity to do that. The city and the Department of Family Support Services will be promoting these services widely with 211, with QR codes, with digital billboards. So the services will be promoted. And so we want to make sure that you have the capacity to receive calls, and we will go into that in more detail later in the slides. We want to provide reentry navigation services to at least 420 returning residents each year, whether they're engaged through outreach or through incoming calls. And so what this means is, of the people that you engage via your outreach, or if they call and they get invited to the center, of those, we want at least 420 of those individuals to get this, what we're calling reentry navigation support. Not everyone needs reentry navigation support. Some people just need a referral and they are on their way. Other people need far more support. And so we want to make sure that those individuals that have the highest need have access to the reentry navigation. And so that's where you're providing intensive, supportive, it's beyond just case management, it's beyond just coaching, it's being very supportive of individuals, helping them in some cases walk through that process, making sure they have a clear understanding of the steps. Sometimes the navigator may need to make a phone call to set up the appointment. There may be instances where they need the navigator to meet them at the appointment. So depending upon that person's need, the reentry navigation is designed or intended to be very intensive and very personal, up close and personal with that participant, to help them stabilize in their community and avoid and to support them on their progress in connecting to their community and other people in their families, etc. Our funding, this is the contract. This is a 3-year contract term. We expect to start on January 1, 2026, and this will be through December 31st, 2028. And so in your proposal, you need to confirm if there's any additional staffing that needs to happen. If there's whatever needs to happen, you need to confirm that all the components will be in place to start on January 1st, 2026. The total funding for this contract term is $1,125,000, and that breaks out to $375,000 annually. And so the goal there is to cover the cost of the call center, as well as the cost of the staffing that are providing the reentry and navigation services, as well as to support any needs that those individuals who are receiving reentry navigation. There may be some support services that have a cost to them. And so we want those resources to be applied in support of that reentry navigation. And finally, the funding is being made available through the City of Chicago's corporate cannabis regulation tax funds. And that's also being provided via the Mayor's Office of Reentry. Our target population, as we've mentioned before, returning residents, justice-involved individuals, system-impacted individuals, and the priority is for reentry navigation. The priority is for individuals that have a probation or parole mandate. Our programs are intended to serve Chicago residents aged 18 and older. If you encounter individuals who have people who are returning from juvenile support or detention centers, or they have their system impacted, but they're under 18, we would like for those agencies to direct them to a youth serving organization where they can get the appropriate services for their needs. Program requirements. Respondents must show capacity to operate, and these are the things that our reviewers will be looking for. They must be able to operate a community reentry support center, and that center must provide the following things, but this is not an inclusive list. Be sure to read closely the RFP for anything that's not listed here. But the priority is a physical location for in-person services, Monday through Friday. Regular business hours, and even beyond that if your agency has the capacity to do that. But we want a convenient location that individuals can walk into. They can meet someone at a front desk, or they're greeted by someone, welcomed into the space. They can communicate their needs and get redirected to the appropriate resources. We list Monday through Friday. We know that during COVID times, there was limited access for in-person services, but now in 2025, the expectation is that an individual who heard about your organization on one of our billboards, they didn't have the ability to call, but they did recognize the address, and they made their way on a regular business day. And we want them to be able to at least get that process started. They may not be able to go through the entire intake or assessment process, but at least they're able to make themselves known to that agency and begin the process of getting their needs met or getting the support they need. We want this center, the reentry centers, to have connections to a wide variety of services for returning residents and justice-involved individuals. That's going to look different across the board, but based on each agency's community area. But we want to ensure that you have a good awareness of what's happening in the community so that you can make the appropriate referrals. Reentry navigation offered tailored support with regard to reentry navigation, and we want to ensure that you have reentry navigators, plural. We're expecting that 400 individuals per year be served. It is, and those needs are going to vary. Some are going to require months of support. Some may only require a few hours or a few days. That's going to vary by individual, but we also know that one navigator is not likely to be able to support 420 different individuals. So we want to make sure in the RFP that you have the appropriate staff to address the needs that may come up throughout the year. We want to be able to connect people to education, job training, and employment assistance. Again, economic mobility is a priority for our workforce services division. We want these agencies to provide mentoring and access to legal support. Again, we're not requiring the agency to provide these services directly if they do not have the capacity, but you should be aware of and connected to legal support agencies that can provide those systems that support for the individuals that you encounter. And finally, we want community-based support for these individuals. So we're asking for agencies to provide letters of support from the community, from key stakeholders in the community that can confirm you are a trusted organization and that you have the capacity based on their understanding. We'll still do our review of your responses in the RFP. But we would also like to see references that can also confirm from the community that you are a trusted organization with the capacity to do this work. More details about program delivery. We are expecting services to be delivered across 3 distinct tiers. And so, as I mentioned before, not everyone is going to come in with the same level of need. And so tier 1, that's your basic call center support. That's an individual that saw you online, or they saw a billboard. They're making a phone call because they had a question or they wanted to get referred to a particular resource, and that's it. And so in this instance, you're offering immediate assistance, information, and referrals to an individual that's seeking help through that centralized phone line. Tier 2 is walk-in support. Those are individuals that may have called and you invited them to come in for additional support. Or you have, like I mentioned in the previous slide, individuals that didn't bother to call first, but they saw your the hours that you're open and they just walked in. And so we want to make sure that people are, the center has capacity to serve individuals who visit the center in person, provide some on-the-spot navigation, connection to resources. Time permits, you're able to do an assessment. But again, just confirming that individuals aren't turned away when they walk in to our community reentry support centers, but that they're provided some level of support on the spot, and then given some clear guidance and instructions on next steps. And finally, we have tier 3, intensive case management, intensive reentry navigation. And that's where, for those individuals that will need months of support, they might have multiple barriers to full reintegration. There may be housing support needs, there may be employment needs, there may be mental health issues. So based on that individual's need, and don't want to over emphasize this, but again, if you are providing services to this target population, you should be very familiar with the wide range of supports that's required. We want to see that reflected in your responses, and we want to see that you have a plan to address all 3 of these tiers. Here's a more detailed overview. Again, the dedicated call line. People should be able to call your center between the hours of 8:30 a.m. and 5 p.m. We expect that there's a voicemail system set up in place after hours, and we would like for the response time to be within 24 to 48 hours. Some people may call on Saturday, so the expectation is that they're getting a follow-up call that Monday. And so we're not requiring Saturday and Sunday support. Great if you're able to do that, if your organization has that capacity. But the minimum standard is Monday through Friday with any responses needed via voicemail or another means. We want to make sure that you're following up within 24 to 48 hours. Again, you should have capacity to receive at least 2,500 of those calls. We had a total of 5 community service centers, reentry support centers doing this work in 2024. We received over 11,000 calls, but there was over 14,000 individuals engaged. So even beyond the calls, there's a lot of ways that returning residents reach out, and we just want to make sure that you have the capacity to engage with at least 2,500 individuals via that dedicated call line. You should be able to provide immediate support and referrals. And so people are calling with a wide variety of needs. The top three over the years have been for housing support, employment, education services, things of that nature, legal support. And so we want the people responding to these phone calls to have some good understanding of what they can expect from these phone calls, to be able to listen closely to what the need is, and then connect them to the appropriate resource, or give them information about coming into your center for a follow-up conversation, whatever's needed. But the individuals receiving these calls need to be trained to screen for a wide variety of needs, and be able to direct them to the appropriate services. We want them to be able to make those warm handoffs to navigators, whether it's an in-person intake, whether it's a scheduled follow-up, or whether you're coordinating referrals. As minimal as we want to minimize people being redirected to resources that are out of date or already at capacity. So as you're making these referrals, again, the expectation is that you're in relationship, or they're a part of your network, and you're able to confidently direct them to that service, so that when they get there, they're expected, and the agency isn't surprised that they're getting a referral from one of our community reentry support centers. We also want to ensure that there's multimodal access. And so that, again, I mentioned that call line is one way that is the primary way people will engage. But like I mentioned before, there was over 14,000 engagements in 2024. And so that could be email, that could be walk-in, that could be community outreach that your teams are doing. But we want the word to get out about these community reentry support centers. And this is why we want to highlight that multimodal access. Trauma-informed staff training. Again, this is about active listening and being aware of what returning residents need as they are returning back from incarceration, being aware of what system-impacted individuals need as they are dealing with an arrest and conviction record and trying to get connected to the appropriate resources. So we expect that an agency be steeped in this work in a way where they know how to engage with the target population and support them appropriately in a way that's human-centered and supportive of their needs. We also expect data tracking and reporting. And so with these call centers, we've collected some good data over the years, which is why we've been able to get this baseline level of information that we have now. And so we want to continue to track what's needed, and we want to be aware of any changes that are happening with the needs of the individuals that we serve. And again, our goal is to connect people to the appropriate outcome, which is successful completion of their probation or parole mandate, avoiding recidivism for at least a year, and being successfully connected to their priority need. Again, not everybody's looking for the same thing, so we want to make sure that what they say they need, it's being responded to, and those individuals can tell whoever is asking, yes, I was successfully connected to a minimum of one of the things I want. Maybe I couldn't get everything, but at least I was one step closer to my ultimate goal. We also want to be able to ensure that we're in coordination with IDOC, Cook County Department of Corrections, organizations like CSAC, the Chicago workforce system at large, and other community-based organizations. We want them to be able to refer to our CRSCs, and we want our CRSCs in relationship to be able to refer to other workforce agencies and other community-based organizations that provide services that are beyond the scope of services that your organization provides. Finally, we want you to be a part of our marketing plan, but we also want to make sure that each individual agency is promoting their services in a way that ensures that individuals know about the work being done in support and on behalf of returning residents. Finally, we want you to have a participant welcome packet. And what this looks like is for those who are going through the tier 3 services, and even those that at tier 2 and tier 1, if there's a packet of information that you can hand out to them, that would be great. But just want to make sure that individuals have access to the information they need when they need it. Specifically those individuals that are coming home from incarceration. A lot of times they might not be ready to engage with a community-based organization or a community reentry support center, but we want those resource packets to be available so that when they are ready to engage, they know who to get in contact with. Tier 2. Again, this starts with a comprehensive intake assessment to identify the need. And so I'll just leave it at that. So in your responses, you just need to be able to talk us through what that looks like for your organization. And then once you have an understanding of the need, we want them to be connected to those key resources. Some need access to those, to an ID or birth certificate that has a cost attached to it in many cases. And so that's where those supportive services come in, because we want that agency to cover the cost if that's what the need is. Helping them connect their Social Security card. There may be mentoring groups that they need to be a part of, or support networks that they need to be a part of. They may need a connection to legal clinics. And so housing may be a need. And we definitely understand, we being DFSS and the city of Chicago understands that the housing resources are limited, but we need the agencies to be able to point them in the right direction where possible, and to be mindful that that is a priority for many returning residents. And so they need to be responsive when possible. And then finally, direct referrals to the appropriate service provider. And that may be the end of your engagement, and that's what we're considering tier 2. Tier 3 goes, in many cases, builds on tier 1 and tier 2. So you've done an assessment, you've helped them get those needs addressed in tier 2. But in many cases, there's going to be individuals, and this is where we're getting into the reentry navigation aspect of it. And so this is where we are expecting that there's one-on-one support provided, and that support is tailored to each individual's journey. It could take months to get this, for this relationship to develop and to get them stabilized. It could be a matter of weeks. It depends on that individual, but this is where we're getting into the more intensive support that many returning residents require. And so this is where we're talking hands-on assistance, which may include appointment scheduling. It may include you joining them at that meeting. It may mean coordinating transportation. If you're just providing a person a bus card and they can take it from there, that falls in tier 2. But in tier 3, you're talking them on walking them through bus scheduling, train schedules, making sure they understand how these different systems work. Again, we understand that individuals have been away for many years and lots of things have changed while they were gone. And so we want to make sure that there's navigation support available. And we mean that just by definition. I envision it similar to GPS, where they give you step-by-step instructions. And if you find yourself providing that level of support, that is what we mean by tier 3 level of reentry navigation support. And so this also includes ongoing follow-up to make sure that if there's additional support needed, that they have access to it, or they have confirmed, no, thank you for your help. I've gotten to that next step and I'm good from here. And so we just want to, and finally, we want to make sure that those individuals with those probation or parole mandates, and they require that sustained engagement, that they're able to successfully complete those mandates and avoid recidivism and be connected to whatever their goals are, whether it's education, whether it's employment, whether it's starting their own business, whatever that may be. Our goals as community reentry support centers is to make sure that they're on track towards achieving their goals. Again, here's another quick overview of those program components: call center operations, reentry navigation services, providing supportive services and referrals. Again, those support services could include helping them get a city key ID, helping them get their ID. They may need transportation support, but there's wide range of services that may be needed, and that depends on the individual. Service coordination, that is collaborating with different city agencies, different city departments, being connected to IDOC and CCDOC in a way where they can refer individuals to you. They can give them information about your organization as a CRSC, and those individuals know where to go once they come back from incarceration. So that requires making sure the institutions that are managed by the Illinois Department of Corrections, they have your information. Again, the Mayor's Office of Reentry and DFSS will support with that, but it will also be great to ensure that those institutions know about your programs and services so that individuals don't feel lost when they come back home from incarceration. Finally, we want we want to know how you all gather how you engage with participants and get their feedback. There will be questions on the RFP. There is a question on the RFP that asks, how do you engage with your participants? Tell us about a time when you took that feedback and made an improvement or a change. There's another question that asks about the data, ask about how you track data and how you utilize data to make improvements. So we take those questions seriously. And so we expect there to be thoughtful responses to those questions so that we can understand as a institute, as a department, and be confident that the individuals that go to those organizations, those individuals are being heard and responded to. And so how we measure that is there an instance, a previous situation where you've gotten feedback from residents, from community members that said, hey, we need this, or we would like to see that. And you all were able to adjust your organization's service delivery model in response to those needs. That's what we mean by being human-centered. That's what we mean by being trauma-informed. Additional components, system-wide referral expectations. And so as we're talking about being responsive and connected to other organizations that are not only providing reentry support, but also providing different human service needs. And so DFSS has community service centers. There's children services division. There's a senior services division. We know that these are individuals with a wide range of needs. And so the expectation is that you are familiar with a wide range of resources so that you can make those connections. We also want you to be able to receive referrals from 211 as well as other community reentry support centers. So we may have, and that's why these zones were established. We may have an individual who lives in the far south side, but they were aware of a resource on the west side. And so we want to, and again, respecting that individual's choice, if they would prefer to be closer to their home address, we would like that CRSC to make that referral to the other CRSCs so that we're ensuring that people are connected to resources that are easily accessible to them. Now, if they choose to go from the south side to the west or vice versa, that is their prerogative, and we're not restricting that. But when the client is asking to receive services closer to their home address, the expectation is that they can get referred to the appropriate resource. Reentry navigation services, I'm going to keep emphasizing that. Supportive services and referrals, service coordination with, and that includes collaboration with a wide variety of institutions and resources to ensure that seamless service delivery. And I'm now thinking that this is just a duplicate slide, but again, participant engagement and feedback. Key performance metrics, we touched on these earlier, but I will go through these again. 60% of all participants who receive those reentry navigation services we're talking about, they either complete that mandate or that parole or probation mandate, or they are on track to complete it, complete those requirements. And if they are not on that, they're on track to avoid recidivism for a year. And so we are funding you for a year. And so that's why we are breaking this down in year components. And so throughout the course of your engagement, the expectation is that they avoided recidivism and they're on track. They've either completed or are on track to complete their community corrections requirements or any type of probation mandates. 40% of all participants who receive reentry navigation services, they enroll in education or employment training. Again, we want to align with the historic needs that we've seen throughout the years. Most or a significant portion of the people that call are seeking employment support. And so again, economic mobility is a priority. And so we want to make sure that they're connected to the appropriate resource. It could be GED support. It could be some prerequisites that are needed in order to get connected to city colleges, for example. And so we want to ensure that your agency has the capacity to identify those needs and connect them where appropriate. 80% of all participants who receive reentry navigation services are successfully referred to their requested need. And so whether it's mental health counseling, public benefits enrollment, The expectation is that you're able to do that assessment and get them to the appropriate support. So for example, if they need help getting enrolled in public benefits and your team doesn't have the experience doing that, just knowing that they could be referred to a community service center or another agency that specializes in that support to get those needs addressed. 80% of all participants who receive reentry navigation services report advancement toward one of their goals. And so our division often gets feedback from the community with either complaints, and sometimes we'll get praise. Usually it's the complaints. And so we want to minimize the complaint that when I went to organization A, they sent me to organization B, which sent me to organization C on down the line. We want to avoid those things and ensure that if they're coming to your agency, they'll be able to report back and say, hey, when I went to this agency, I told them what my needs were. They didn't have what I needed on site, but they walked me through the process to get me connected to what I needed. So I'm grateful for their support. That's the type of feedback that we want to hear. And the expectation is that at least 80% of the individuals that are asked can report that that is what happened. Again, this is our performance metrics. And so just want to reiterate those calls to the community reentry support centers, 2,500 and 420 returning residents engaged via outreach or those calls. And so when we get to that tier 2 and those tier 3, that means they've completed a risk needs assessment. It could be a skills assessment. You need to tell us what that looks like for your organization. They could connect it to the appropriate resource, whether it's healthcare, housing, transportation, financial support, whatever that looks like for that individual. You all are providing the appropriate level of support. We also acknowledge that there are some expectations that are unrealistic. And so the idea is that when you encounter someone like that, an individual who doesn't have realistic expectations, there's a conversation that goes along with it versus just slamming the door on them and saying that's impossible. And many times people just don't understand what's not realistic or what's not what they're not ready for. And so the idea is that you've built a relationship with those individuals to understand what the need is, to help them manage expectations in a way and show them what the steps are. Enrolled in education, job training, public benefits, whatever it is that they are asking to do, there's a process. And so the expectation is that you all can guide them through that process. Receiving support, these are just examples of the types of needs. And so that people may be asking for support with child support challenges. They want to get reconnected with their family. They may have some custody issues that they are dealing with. They may need some legal advocacy. And so to the degree that you are not able to provide that support directly, we want to ensure that you have knowledge of the resources where they can get the appropriate level of support. And your reentry navigator, if it's defined as reentry navigation, if you've made that referral, you've followed up with that participant or that agency to confirm that they are on track to get that need met, and then available to provide additional support as needed. And so access flexible employment opportunity, whether it's part-time needs or whether it's a full-time employment or whether it's just job training on their way to their employment goals. We want to make sure that your agency is flexible and nimble and able to connect them to the appropriate resource. That's why the navigation is so important. Not all agencies are equipped to do all things. And so those navigators are those individuals assigned by your organization to walk people through those processes and then connect them in ways that your organization cannot. Case management and data reporting requirements. This is going to be a big emphasis as we go through the year. We will have quarterly meetings at minimum with our department, our division, DFSS, and the Mayor's Office of Reentry will be invited. There may be other stakeholders invited to these meetings as well. We want to ensure that you're collecting and reporting on client level demographic data. We want to know who you're engaging with. We want to make sure that there's, and so we use this information to understand the trends and the needs over on a high level. And so we also want to know the outcomes of the effort that you've put into individuals that you're working with and encounter. And we also want to know the types of services that are being requested. And whether or not there are, and if we are finding that there is a resource that the city of Chicago needs to allocate more resources to, this data also helps us advocate for that where possible. These reports will be submitted every month. We'll walk through what they look like in some future slides. And we're also using what we call ECM, and that's the Enterprise Case Management System. And so that we want to document specifically those reentry navigation supports. We use our ECM system to document those interactions. We do understand that many agencies have their own system, so this may be duplicate in some cases. However, we want to have our own. We want your activities documented in our system of record. If you don't have a system like this, this is available at no cost to the agency. But if you are tracking this in a separate system, we're asking that you make sure that you're also documenting your activities in our ECM system. And then as we go throughout the year, and as we engage with the community and as the community tells us what their needs are, there may be additional reporting requirements. And so we will be in communication with you if that comes up. However, we've tried to be as proactive as possible on the front end to track as much as we know has been important over the years. And that's also why we ask in one of our questions, we ask if you have any metrics that you think would be important to capture. We encourage you to share that, and we will take that into consideration. This takes us a little bit deeper into tracking those reentry navigation services. And so that initial intake and assessment, that's one way that we want to confirm. That's an output that we're using to confirm that the process of reentry navigation has started. We want to make sure that's documented in our ECM system. And as a part of reentry navigation, we have what's called individualized service plans. In our workforce components, we call them individualized employment plans. In education, they call them individualized education plans. This is what we're calling those needs. And that's in that course of that conversation, the individual has shared, my goal is to find a job, or my goal is to enroll in school. My goal is to get my record expunged or sealed, whatever the case may be. We want to document that, and that's another way. So even if a person says, I didn't get any help. They didn't serve me, because many times people are frustrated. Your agency can document, well, we couldn't help them with everything, but we did help them with this. They started here. They said this is what they wanted to do. These are the things that we did help them with. And so we can't please everyone, but as an organization, the expectation is you're doing your due diligence to understand what the need is, and to provide the appropriate level of support and to show progress toward those goals. And so we want to log those services that you're providing when you're meeting with individuals. Again, people need a wide range of support. Some people need check-ins every 30 days. Some might need some intensive weekly engagement. Some may need an even higher level of support. Whatever it looks like, this is relatively new. We're asking that you document that so that we can feel confident, one, that this is the appropriate level of support that's needed for our target population. And if it's not, that'll show in our documentation. If it is, and we're finding that we need to invest more resources here, that will also show in our documentation. So that's the primary reason why we're looking to make sure that you have all of these things documented in our system, so that if there's a change in staff at DFSS or whoever, if we need to look back at historical data, we got good notes, good details as to the types of services that have been provided, and the types of gaps, if any, that we need to fill. We also want to track whether or not someone is on probation or parole, and whether or not they are getting your help to get connected to those appropriate resources. We want to record key milestones. If it's their goal for employment, we want to show, hey, we help them get connected to this many interviews. We help them get a job. They started on this day. They hit 30 days and then they lost the job, or they got the job and they stayed on for 30 days and they stayed on for whatever that looks like, and whatever's appropriate to that participant's needs. We want you to document those milestones, and again, we'll show you where we're tracking that on our monthly report and how that's being documented in our ECM system. Finally, we want to make sure that you're scheduling and documenting any follow-ups or retentions that are needed, and then you're completing case notes and final outcomes. If you have individuals that need to exit out of your program, just want to make sure that's being documented to show the effort that you're making with the individuals that you serve. And here's a template that we have been using. May be very hard to see on the screen, but what we're seeing on the left-hand side is the total number of engagement, total number of phone calls, people that are walking in, people that refer from IDOC, and some of these may be zero. Some may be you may only get phone calls. You may not engage with people in your outreach activities, number of presentations you make at job fairs, etc. We just want to show and track what type of engagement we have with returning residents. So again, the goal is to make sure that the city is aware of our services, and that people are, and how we track that is on that right-hand side in those peach colored sections. Some of these aren't going to be appropriate for our new fiscal year, but if there's a need assessment that's done, again, that's the start of what we call reentry navigation. If they've been connected to a you see this enrolled in a reentry program, if they've been connected to a support group of some sort, or if they've been connected to an employment training. That's where you document that. That's where we see the number of participants enrolled in a reentry program. And then we have the case management sections. And so you might have people that needed referral to education, and you help them get connected to that. They needed housing assistance, you help them get connected to a housing provider. They needed, if there's a need that your agency was able to meet, you can document that here as well. And so this is what we mean by some of these columns will be changed. Some will be added to make sure we're capturing information that we're finding is trending or important to know. And so these monthly reports will just capture that in a snapshot of what's happening. And so here we have an example of on the right is just how this looks monthly. And so you'll provide this to your program coordinator. They will compile this into a spreadsheet like what we're seeing here, and we'll be able to see month by month the progress each agency is making. This is another view where you're able to see individuals, and we will walk through these with each agency as you're onboarded, but we just wanted to give you a snapshot of what these will look like as we go into the new year, in addition to what's happening in the ECM, and we will also provide training on that system as well. So here, I've talked a little bit about it throughout the presentation. And so in this section, we'll talk about how we are going to be assessing these responses. And so eligible respondents, you may apply as a single agency. You may be a lead agency with multiple agencies serving as subcontractors. We leave that to your organization. This is open to not-for-profits, faith-based organizations, and even beyond this criteria, there's a full list of who this RFP is open to within the RFP, so make sure you're reading that closely. Evaluation process, these will be evaluated based on your strengths and responsiveness to the selection criteria. And so it says community selection here, but it's actually community engagement. And so there's a set of questions appropriate to that section. It's worth 25 out of 100 points. So again, you want to be mindful of how you respond to these questions because some of them weigh more than others. Organizational capacity, that's where you're telling us the staffing level that you think is required to serve to receive 2,500 calls annually and to serve at least 420 individuals with reentry navigation. There may be others, staff included, working on this project. So just want to understand your organization's capacity to do this work. We're asking about your familiarity with the needs of returning residents. So again, we expect that you respond thoroughly and comprehensively and in a way that demonstrates your deep knowledge and deep history of engagement with serving this target population. Strength of the proposed program, that's 25 out of 100 as well. And so this is where we're talking about, we want you to walk us through, what does it look like for someone just to walk in and say, hey, I just got home from Stateville. I can't remember if they're still open, but I just got home from incarceration or from Cook County and I need help. What does that look like to walk that person from walking into your door, getting connected to reentry navigation, and getting connected to the appropriate resource? We want to imagine that for the participants that we expect to be coming to your organization. Performance management and outcomes. You may be new to DFSS, but you should not be new to this work. And so that will be demonstrated by this section. You should be able to show us your history of working with returning residents with data. You should be able to show us the outcomes that you've had engaging with individuals with reentry needs, and you must be able to show your ability to connect them to the appropriate resources. And finally, reasonable cost, budget justification, and how you're leveraging other funds. Where our DFSS will be funding this at $375,000. You may say that this costs more than that, and here's how we will be supplementing that. We need you to be comprehensive in that budget. We need you to show us why you're doing what you're doing and how you plan to allocate these resources to appropriately serve the population. So here's more detail about the selection process. Proposals will be evaluated based on their strength and responsiveness to the specified criteria. DFSS may consult with other city departments during our review. Top scoring respondents may be invited to give an oral presentation with some advance notice. Incomplete or unresponsive proposals will be rejected. DFSS may deny funding based on past performance or current area needs. We only plan to fund one organization per zone. So that may be a reason why you may have an individual that scored higher than another individual in another zone, but each zone is going to be reviewed independently. All services must be available citywide and delivered in culturally and linguistically appropriate ways. And so by this, we mean, while we encourage individuals to go to their nearest community reentry support center, it may be that they prefer, for a wide variety of reasons, they may prefer to go to a reentry center in another location. And so we want you to be able to accommodate that as appropriate. Again, applicants must specify the zone for which they are applying. Those applying for multiple zones must submit a separate application for each zone they are interested in. So there should be a drop down where you can identify what zone you plan to apply to. DFSS may consider organizational leadership, the geographic coverage, and the ability to serve specific subpopulations. And so if you're able to demonstrate strong ability and strong engagement dealing with individuals who have probation and parole mandates, that's excellent. And we want to see that in your responses, because that will be how our reviewers are able to say, you know what, this organization is good, but here's evidence that shows that this other organization has experience and capacity to serve the target population adequately. DFSS reserves the right to request clarification. That's where we're talking about those follow-up interviews. We will reach out to your agency and set up some time with your organization's leadership team to clarify some of the things that we saw in the RFP. We may need to do a site visit, and we may require an oral presentation. If any of those things are required, we will reach out with you and give you enough time for your team to meet with us. Again, incomplete, unresponsive proposals will be rejected or may be rejected. Selections are not final until a contract is fully executed. And the commissioner Upon review of the recommended agency may reject, deny, or recommend agencies to have applied for grants based on previous performance and/or area need. This is a rare case, but we just wanted to highlight that it is possible. Our reviewers may see things one way, but the commissioner may see it another way, and they will have justifications for this, but just wanted to make you all aware that you may have the best scoring application. However, the commissioner may decide not to select an agency based on previous performance and/or the needs of the area that we are trying to serve. Community involvement. This is more detail about the types of questions you should expect. If you haven't already reviewed the RFP, demonstrate a clear understanding of the target population returning from incarceration, including their unique needs and challenges, and how your CRSC plans to help address those needs. You must show you have expertise working with this target population, and you have the relevant capabilities and infrastructure needed to serve this group. And so that we anticipate this looks different over time. If your organization has been around for 30 years and you're doing things the same way you've done it 30 years ago, that doesn't bode well for this RFP. We want to show that, okay, you've been doing this for 30 years and you've adapted your programs in this way or that way in response to the community's needs. And so I'm just asking you all to be mindful of the questions. And if you have questions about those questions, there will be a time in this presentation to ask those. Hopefully we can address them immediately, but if not, you can submit those questions via email and we will address them in an amendment. However, we just want to make sure everyone is reading the questions and being responsive to those questions. The respondent demonstrates experience and capacity to work with IDOC and CCDOC to engage returning residents pre-release. And so right now, Director Mapp from the Mayor's Office of Reentry, he is engaging with the IDOC to understand or explore what that could potentially look like. And so as those conversations are happening, we want you to be prepared to engage with IDOC or Cook County DOC to engage with participants pre-release as appropriate. That could be as simple as making sure your flyers are available. It may be that your organization is invited to do a presentation at the facility. That's going to look, how that looks will be determined as we go forward. But we just need you to confirm you have the capacity to do that within your responses. Organizational capacity. Respondent has qualified staff responsible for program execution and management. Qualified staff in our case does not mean they have a master's degree in social work or anything like that. That means that your staff is trauma informed. They have experience working with this target population, and they have the compassion and empathy required to do excellent work and to be supportive as needed to returning residents. The respondent has adequate systems and processes to support monitoring program expenditures and fiscal controls. The respondent has adequate systems and processes for data collection and security. We want to know that your staff is meeting with participants and documenting those interactions in near real time. This looks different across agencies. Some do it require that those agencies are updating those notes, case notes right away, same day. Some have a special day that they set aside for updating case notes. Whatever that looks like, we want to know that you have a system to collect data and that it's a secure process. Again, our ECM system is secure, so that's not a priority, but there could be paper files that you are collecting. And so we want to know what that process looks like and how you make sure those documents are secure. Finally, the respondent has a computer lab or capacity to deliver digital literacy services to participants. And so, again, if your building doesn't have a computer lab on site, where are you making sure those participants get that level of support? And how are you making sure that they get to that organization or agency? So we need to know what that looks like. Digital literacy is a significant need for individuals that have spent a long time in a carceral setting. And so we want to make sure that they have access to that support. Strength of the proposed program. And so again, we're looking at that, like I mentioned, we want you to walk us through what that looks like for participants. If they're calling the call center, what does that look like? If they're walking in, what does that look like? And if they need to be, what does the overall process look like? And so we want your services clearly defined. What are you providing? And so you saw how we track if you're making an internal referral or an external referral. We want to know what that looks like. We've highlighted a few of the common needs, whether it's employment, education, housing, etc. What does that look like in your community area, in your zone? How will you make those referrals? Is your proposed program supported by strong national or local evidence? And so as you tell us about that program model, you're saying, well, we do it this way because our experience tells us that's where it's critical for agencies that have been around for a long time. Our experience has shown that our target population, which is returning residents, they respond better to services when they're provided in this way. And so whatever that looks like, your program model needs to be supported by experience or national best practices. You can point to for example, if we're talking transitional jobs, there's a lot of research that shows transitional jobs for people that have been long-term unemployed or have significant barriers to employment. Transitional jobs is a great way to help people learn on-the-job skills so that they can find a permanent employment opportunity. So if there's a relevant example that you can point to with research or other evidence, we need that to be reflected in your response. You have a practical approach to recruiting and retaining the required number of program participants. And so, again, a lot of times you have individuals that don't know that they need intensive reentry navigation support. And so what does that look like? How do you plan to engage individuals that don't know what they don't know? How do you plan to engage individuals that have never heard about community reentry support centers? How do you plan to ensure that you are reaching if you're not getting 2,500 phone calls, what are the strategies you'll take to make sure that the word is out about your programs and services? What are the strategies you are taking to make sure that parole and probation officers are making referrals of their clients to your organization to get the support they need? And so we want to see that level of detail in your responses. Respondent has partnerships or coordinates with other agencies to expand or improve services in a client-centered, comprehensive way. And so the expectation is not that you will provide all the services in-house. If you can, that's great. We want to see that you have capacity to do that if that's the case. If not, however, we want to know who are your partners. And are they in your zone? And if your zone doesn't have those resources, how are you making sure that the participants you refer get connected to the resource that you're referring them to? Finally, again, we want to be confident from your response that you have capacity to field those phone calls and provide a minimum of 400 service reentry navigation services to a minimum of 420 individuals per year. And so I'll leave it there, and because the goal that's our minimum requirement. Like we showed before, there's more people that need there's more people returning from incarceration than what we are able to serve. And so we know that the need is there. And so we want to make sure you have capacity to engage with them and be responsive to those needs. Performance management and outcomes. Respondent demonstrates evidence of strong past performance against desired outcome goals and performance metrics and/or other notable accomplishments in providing services to the target population. And so you may be relatively new, but you have strong performance against these goals. You may not have had a call center, but you can demonstrate that you have strong engagement with returning residents. And so we want to see that you have a history of serving returning residents and connecting them to resources, connecting them to employment, whatever the case may be. Being able, you want to give the reader, the reviewer, confidence that we know what we're doing. We know how to serve this population. We've talked about the process. We've talked about our capacity in other sections of this response. And here's where we show evidence in using numbers, data that aligns with the goals of this RFP. Respondent has experience using data to inform or improve its services. That goes back to the statement I made earlier. You have data that you've collected over the years and feedback from participants that have encouraged you or informed or enhanced the way that you provide services. You may have added a new model, or you may have added a new process in order to make sure that you are being responsive. And it may not necessarily be with a program specific to returning residents, but in this section, we need to know that your agency, your organization is being participant-centered, human-centered, community-based, and is being responsive to what's happening within the zone, within the community that you have targeted to serve. The respondent has the relevant systems and processes needed to collect and store key participant and performance data. And so again, some of these questions may seem redundant. There is some nuance to these questions, so make sure you're reading them carefully. And so we want to make sure that the system is in place, the how you do it, the process is in place, is there so that you can collect what we're asking to collect. And if you have suggestions for additional metrics that should be tracked, make sure you include that in the appropriate question. Reasonable cost, budget justification, and leverage of funds. And so, again, we know that this is expensive work to support people who often have zero, and many of them have debt. And so they're coming in with less than zero to help stabilize them and connect them to the appropriate resources and empower them to thrive. That's a part of our mission. And so we want a thoughtful response that confirms you have the capacity. We do a reimbursement model. There's a lot of flexibility in our vouchering process. but we do not provide advances. And so we need confidence that you're able to start January 1. And so if you are leveraging resources to do that, we need to see that so that we can be confident that we're not waiting 3, 4, 5 months because we have a contracting process. And so what that looks like could, depending upon how quickly each agency responds to the contracting process, that may delay the actual execution of the contract, which may delay vouchering. However, our expectation is that the program, those program costs will be covered. However, we want programming to start January 1. So it may not be the full suite of services, but we want programming to start. We want to be able to announce to the general public that they can call these organizations. And so on not January 1, because that is a holiday, on January 2nd, if it's not a Saturday or a Sunday, the expectation is that an organization, a Chicago resident, especially one that has just gotten home from incarceration, can call, can email, can walk into one of our community reentry support centers and start getting the help that they need. And so the way you show that and demonstrate that is in this section. And so you have the fiscal capacity to implement the proposed program and has the capacity to operate and be reimbursed. And so that's what I'm trying to explain with that last bullet. The respondent leverages other funds and in-kind contributions to support total program and administrative costs. We know that the cost of these services may exceed the total cost that we have available for each organization. And so if you're to be able to provide services on January 1, that's going to require other resources that are filling in the gap until contracts are executed and your organization can voucher for the services you're providing. The respondent demonstrates reasonable implementation costs and funding requests relative to its financial and human resources. The proposed budget supports the proposed scope of work or work plan. And so in some cases, the fiscal team and the program teams respond to RFPs independently. If that's the case for your organization, someone needs to make sure that those pieces of information are talking to each other in a way that makes sense to our reviewers. And so we'll be looking at the budget that you submit to make sure it aligns with what you proposed in your strength of programs and in your organizational capacity. Those we want to see and be very confident that the agencies selected for this work can do the work, have the capacity to do the work, and can make sure that there's high quality support for individuals as needed. Finally, attachments. Be sure to have attached reports, studies, letters of support that highlight your program's performance and demonstrate your program's impact. Attach the resumes of key staff who are overseeing the program. If they're not hired yet, make sure you have a clear job description of what they're going to do. And be sure to attach, and also make sure in your response, if there's staff that need to be hired, make sure we know how many, and make sure we have a good sense of how long it takes to onboard those individuals. Be sure to attach your organization's org chart and the budget for this program. make sure all program requirements are addressed in your response. So here's our timeline. Today is July 18th, and this is our pre-proposal webinar. If you have any questions based on what you heard today that cannot be responded to while we're on the call, if you have questions now and that I can't address, we will respond to them via the amendment. So just make sure you check back into the RFP because there will be an amendment posted shortly after August 22nd. So even if you don't have questions today, you have until August 22nd just to email your questions. And we will make sure that we respond to them via the amendment and ensure that everyone has equitable and fair access to the questions, even if they weren't on this webinar. So this will be recorded and posted in on our DFSS YouTube site so that you can come back to this if there's something that you may have a question about that just doesn't make sense. And again, feel free to reach out via email if you have additional questions. Finally, our program period begins January 1, and the contract term is through December 31st, 2028. So again, just a real quick overview of what I just mentioned. Total of $375 awarded annually, one budget for 1 year of services. And so we're not asking you to submit a budget for the full 3 years. We want to see what, because our process is to apply funding annually. And so we want to see what your annual program costs are and how you plan to support individuals each year. The contract term, you see it there, January 1, 2026. So while we're asking you to start programs ahead in advance of the program, every cost associated with this program beginning on January 1 can be vouchered for and will be reimbursed. And so just want you to keep that in mind because again, the expectation is that you're ready to start programming January 1. And so somebody, if they're calling January 1, they should be able to leave a voicemail and get some type of follow-up within 48 hours. The match recommendation for our program, 10% or higher, just a recommendation, not required. This is again a reimbursement basis, no advances will be provided. Cost category definitions are attached as budget instructions in every RFP. Be thoughtful and inclusive when you're developing your budget. Apply for your program's cost. We cannot provide you with more money than you request usually. So just be mindful of that. And then also use the reasonable cost question on the application to discuss how you determine the costs reflected in your budget. Some common errors that we've seen over the years: fringes might not add up, supplies maybe under or over budget, client assistance, it is an allowable cost here, so make sure that's reflected in your budget, and then make sure you're putting your budget in the appropriate column. There's sections that show what the city will be covering with each proposal, what's being covered with other funding, and just make sure everything is appropriately aligned, and that will allow you to show your match. Again, applications are due August 22nd at noon. We've had instances where people thought it was close of business or at midnight. August 22nd, 12 p.m. noon, Central Time.
Thank you, Mark. At this time, We're gonna address the one question that we have in the chat. It says, is there an active vendor performing this work today?
Can you repeat that?
The question is, they said, is there an active vendor performing this work today?
Yes, we currently have 5 community reentry support centers. They are not aligned to these zones. So there are organizations actively doing this work. However, our goal is to continuously improve the quality of services that are being provided. So we are looking to hear from community-based organizations that have capacity to do this work. And we want them to use this RFP to demonstrate that capacity. So we're satisfied with our vendors, but their contract term ends December 31st, 2025. And so they understand that this is a competitive process. And so we want to allow organizations that have capacity to do this work, we want to allow them the opportunity to respond to this RFP and to provide services within the zones that they selected.
Thank you, Mark. That question, as well as the answer, will also be in the amendment that will be posted. At this time, we're gonna go delve into application tips really quickly. Our first and most important application tip is to start your application as early as possible. If you have never done business with the City of Chicago, please register into the iSupplier system as soon as possible. Review RFP narratives and application questions closely. Remember that they align with the scope and selection criteria. Use the information in the RFP for guidance in formulating your answers. There is a 4,000 character limit, which includes punctuation and spaces. Each response is allotted 4,000 characters. Please try not to use the back button on your browser. You could potentially lose your work. Again, we can't stress it enough to try to start your application as early as possible and to save it as often as possible as you work on it. Some tips from working in procurement. To submit multiple applications for a single RFP, applicants would need to set up a unique user account in iSupplier. The e-procurement system is not capable of submitting more than one distinct proposal per associated email address. Therefore, you must use a separate email address for each submission. You can submit your application and later amend it up until the due date of August 22nd, 2025 at 12 noon. Avoid the rush and mishaps by submitting early, and plan on submission taking approximately 30 to 60 minutes. Please be advised that late applications cannot be accepted. For assistance, please make use of the e-procurement hotline for help at 312-744-4357. And the hotline also has a customer service email, which is customersupport@cityofchicago.org. The hotline operates during business hours only, Monday through Friday, 9 a.m. to 5 p.m. Some agency requirements. We require that agencies provide articles of incorporation and any amended articles of incorporation. We also require an IRS affirmation letter for not-for-profit agencies. And this letter must be dated within 60 days of your submission. You can obtain this letter by calling the IRS directly at 1-877-829-5500. If you are a for-profit agency, please submit your original letter from the IRS showing your FEIN number. A UEI number is required, as well as your central contractor registration, which can be obtained from the entity overview page on the sam.gov website. Lastly, the certificate of good standing letter with the state of Illinois is required. As of April of last year, we have a new labor peace agreement ordinance, which will apply to all DFSS and CDPH delegates that have 20 or more employees working for their organizations. The only exemption are hospitals. Contractor must provide written notice to the commissioner or her designee within 72 hours of becoming aware that employees want to organize or that a union seeks to represent employees. Contractor must enter into this LPA within 90 days of receiving notice. You may ask, what is an LPA? An LPA, also known as a labor peace agreement, is an agreement between an employer and a labor union that ensures that an organizing drive is not impacted by union busting techniques, including employee retaliation. And in return, they will not strike or stop work in a way that would impact human services. For technical assistance, there will be a link to the RFP of interest and training documents. Please see the alerts section on our website. For questions regarding registration and e-procurement technical assistance, again, please contact the customer help desk email, customer support at cityofchicago.org. They also can be reached at 312-744-4357. And lastly, we do have training materials, which include documents and videos on the cityofchicago.org website, located under online training materials. At this time, we're going to delve into how to enter your responses and accepting the amendments. Step 1, please select Create Quote from the drop-down menu in the Actions box and then click on Go. This will take you to the application page where you can get started. If the RFP you are interested in has been amended, you will need to acknowledge and accept that amendment in order to start or submit your response. To accept the amendment, click View Amendment History. To begin the acceptance and acknowledgement process, please follow these steps after clicking View Amendment History. First, you click on the document number. Next, click on the infinity or eyeglass icon to review the amended changes to the RFP. Next, you click on the Acknowledge Amendments button to acknowledge receipt and understanding of these changes to proceed. And by acknowledging the amendment, you are indicating that you are aware of the changes made to the RFP in the amendment. When you get to the screen, click on the I accept checkbox and then click on Acknowledge. Next, you click on Yes to indicate that you confirm your acknowledgement of the amendment. Finally, you click on the checkbox that you accept the terms and conditions, and then you click on Accept to accept the terms and conditions. And that is the final step in acknowledging and accepting the amendment. Once the amendment has been acknowledged and accepted, you can move forward with submitting your application, which is what we'll dive into right now. When you are ready to submit, meaning that you've attached all required documents and you've answered every requirement question to the best of your ability, you start by saving that draft one last time, and then you click Continue. If you are missing information, you will be given an error message at the top of the screen. Usually, the error message directs to something left undone in the application. In the last example, the error message indicated that the lines found under the Lines tab had not been completed. In this example, the error is about an unanswered question in the application or the requirement section. The quote value refers to your, in this case, missing answer. Once your application is free from errors, you are ready to proceed and submit. And at this point, clicking Continue should put your application into the review and submit phase. Once you get to this screen, this is like a summary page, and this is also your last chance to review all of your data and to confirm that everything is accurate. Please triple check your attachments and your responses and scroll to the bottom of the screen to see every response. And at the very bottom of the screen, you will be asked to provide an electronic signature. Please be sure to fill in that signature before checking the box. And lastly, you click submit. Make sure that you see the submission confirmation screen. The e-procurement system will send in confirmation email within 24 hours of your submission. However, please feel free to reach out to me. My name is Jillian Black at jillian.black@cityofchicago.org if you desire confirmation prior to receiving that email from iSupplier. And at this time, we're gonna pause one more time for questions before we log off. I don't see any new questions, but there still is time to ask questions up until July of 22nd, which is next Tuesday, at 5 p.m. That's the deadline. So those questions can be sent to Cindy Rivera. The contact information is on the screen here. And for any non-programmatic questions, if you have any issues with iSupplier, the e-procurement hotline, I will suggest you get in contact with them. They're the best people to assist. And again, their number is 312-744-4357. They also can be reached via email at customersupport@cityofchicago.org. And you can also reach out to me. Again, my email is jillian.black@cityofchicago.org. And before we log off, does Workforce have anything to add?
Just want to say thank you all for your attention and participation. We appreciate your interest in this RFP, and we look forward to reviewing your responses. Thank you.
Thank you everyone for attending the webinar. Good luck on your responses and enjoy the rest of your day. Thank you all.
Thank you.